Hello everybody, welcome to our YouTube channel Knowledge Terminal, and in this video today we are going to discuss about the process of subinvolution. So subinvolution is actually a complication that occurs in postpartum period. Let us discuss first about involution, then understand what subinvolution is. So involution is actually a process that occurs in postpartum period after the childbirth, in which the uterus, which has grown huge in size, it reduces its size, it reverts back in its normal pre-pregnant state, both anatomically and physiologically. In simple meaning, see, when a woman conceives and pregnancy period goes on, the size of the uterus increases in order to accommodate the space for the fetus. So once the fetus has been delivered out, this uterus, which has grown huge in size, it has to come back to its original state. So this process of uterus reverting back to its normal stage, its normal size, its normal function, we call this process as involution. So what is subinvolution now? If this process of uterus reverting back is impaired, then that process we call it as subinvolution. In simple words, subinvolution is the uterus will not return back to its pre-pregnant state. So involution, the process in which the uterus revert back in its pre-pregnant state anatomically and physiologically. When the involution is impaired or retarded, we call it as subinvolution. And the most common organ which is affected in subinvolution is uterus. Then what are the causes that cause subinvolution are? The predisposing factors under this are grand multipara. Now grand multipara is a woman who has delivered more than 5 babies. So as she keep on conceives and deliver the baby, the uterine musculature and rigidity might be disturbed or damaged, due to which there may be risk to develop subinvolution. Then over distension, so in case such as multiple pregnancies and polyhydramnios, where the uterus is enlarged or extended more than its normal capacity, due to which the rigidity or musculature have been disturbed, and directly or indirectly it may cause subinvolution. Then if maternal any ill effects on the mother, even it constitutes for subinvolution. Then if the mother has undergone any cesarean section, in that cases also there is risk to develop subinvolution. Then if the uterus is prolapsed, prolapse of the uterus is actually falling the uterus in downward direction out of the vagina. That process we call it as uterine prolapse. If the uterus is prolapsed, if it is not in its normal position, then in that case also there will be subinvolution is seen. And now retroversion of the uterus. Generally uterus is antiverted and antiflexed. If the uterus is deviating in opposite direction from its normal position, we call it as retroversion of the uterus. It is simply a displacement of the uterus. See, prolapse is falling down of the uterus, whereas retroversion is displacement of the uterus. It is in position, but its angle has been changed. Then if there are any fibroids inside the uterus, even it may lead to the risk of subinvolution. Now what are the aggravating factors that increase the risk for subinvolution are, if there are any retained bits of products of consumption remained inside the uterus, even it may increase the risk for subinvolution. Then if there is any infection of the uterus such as endometritis, that may cause subinvolution of the uterus. Now what are the symptoms we see during the process of subinvolution? Generally this subinvolution is asymptomatic, but in certain conditions we can see there will be abnormal local discharge. It might be excessive or prolonged, and there will be irregular or at times excessive uterine bleeding, that is not continuously, it is coming with intervals or gaps in between the bleeding episodes. Then there will be irregular cramp in case of retained bits of products inside the uterus. If the products of conception retained inside the uterus, there will be clinical feature will be irregular pain or cramps. Then if there is any infection inside the uterus, the clinical feature will be fever or rise of temperature of the body. Then what signs we can see during this subinvolution are: the height. Generally see, As the day of the puparium or the postpartum period increases, the size of the uterus should decrease. See, what we have seen in involution is, it is a process where the size of the uterus reduces and it return to its normal state how it was before the pregnancy. So as the puerperal period increases, the size of the uterus must decrease. But as there is subinvolution, there is no sign of involution, or there is no progress of involution in the body. The size of the uterus will be more than the period of puerperal period. See, puerperal period should in as the puerperal period increases, the size of the uterus must decrease. But here it will be opposite. As the puerperal period increases, the size of the uterus will remain same. It will not reduce, it will not come back to its normal pre-pregnant state, and the uterus will be soft and boggy, and there will be features which depict the subinvolution process. Then what can we do to manage this subinvolution? If there is any infection inside the uterus, to manage that we have to provide antibiotic therapy. And in case of any retained products of conception, we must explore the uterus and dilate and evacuate the products of conception. And in case of prolapse or retroversion, pessary treatment is given. Or if there is any bleeding, to control the bleeding, ergometrin is given, and to enhance the process of involution, methergen is given. So this was about the management of subinvolution. Now we have discussed about pessary treatment in case of prolapse or retroversion. So what is pessary? Actually, pessary is a mechanical device that contains certain drugs which is inserted pervaginally, that helps in holding the uterus in its position. Now these pessaries come in types. There are three types of pessaries. See, donut pessary, first one is, and this one is donut pessary. This one, is the ring pessary, and this one is Gellhorn pessaries. So these are the mechanical devices which are inserted inside the uterus. As you can see here, see, it is inserted inside the uterus pervaginally, that helps to hold the uterus in its position and slowly release the medications inside, that shows its effect on the uterus. So this was about the process of subinvolution. I hope you might have understood the concept. It was little bit simple concept. If you might have liked the video, please do like, share and subscribe to our channel, and please follow and press the bell icon to get notifications for further such interesting videos about the subject. Thank you.